This is an internal-external pile mass, okay, and these are the internal piles. So, okay, so once I go in, I'll be able to show you. I mean, this looks like 7 o'clock and this looks like that 11 o'clock. So we'll use LigaSure and bloodlessly remove all of them. I've held it with a Alice forceps, the internal-external pile mass, and I'm going to save as much skin as possible. It's at the mucocutaneous junction. So by doing this, tenting it up, I'm going to save the skin and stay outside the external sphincter. This way I can bloodlessly reach the pedicle. See, it started getting lifted. Just by a little cut is getting lifted, and now I'm going here. This is the external piles. So I'll take the external piles with the LigaSure. Otherwise, it's a very bloody dissection, but you'll see majority of the times we can do it without a drop of blood. You can see this is an external pile, a bared external pile. So I'll cut through it like that. Cut through it like that. Quite a thick external pedicle. It's got lifted off. The external piles we've cut. So we are now reaching the internal pile mass. A very good positioning, a very good assistance is a must. And this instrument is amazing. Much better than laser, because laser will burn the piles. This is going to remove the piles, and burnt tissues left in the body is actually very morbid. You see, the whole thing has become one pile mass. This whole thing is one pile mass. Well, so far we've not had a drop of blood. So all this would have become very bloody had we used diathermy or any which way we had tried to approach them. So I've now started taking the internal pile mass, but I here have to take 2-3 clamps, because if this bleeds, it's going to become difficult to handle it. So I'm taking the pedicle. Very difficult to handle it. So this is the pile mass, internal, external. Okay, the internal. So these are internal piles. This is about 2 o'clock. They're secondary piles, and this is about 5 o'clock. So we'll have to take them. I don't need to take the skin along with it, because it's only purely, see, they're kind of bunch of grapes, and there are plenty of them, primary and secondary. So we'll take them. Yes, very good. There's one more left. There are unusually too many. Normally we have 3 primary piles and about 3 odd secondary piles. Here there are too many of them, so we'll see, because we can't remove all of them. If we remove all of them, it will lead to narrowing of the anal canal. This is one more at 11 o'clock. So there are so many of them. We perhaps would require anal dilators for him post-surgery. So as a prophylactic measure, we will advise him anal dilatation. There are too many of them. We can't leave them also, because they are very bulky. They are all 3rd degree. So 3rd degree piles cannot go on their own. So we have removed all of them, you see. And there's one still there. You see, there's one still there. This one is still there. And these are all going very high up. And well, we'll take them all. Otherwise, he'll continue to be symptomatic. He'll continue to bleed, Sphincterotomy is necessary to reduce post-op pain. Otherwise, the spasm causes a lot of pain. So I've done a bit of lateral sphincterotomy. Give some local anesthesia, regional, I would say, both the ischial foci and pre-coccygeal. That also takes care of pain post-op, and this is going to work for about 16 odd hours. This is ropivacaine, and hence we expect that it will be a painless recovery.